Okay, welcome to this video on growth options for dentists. Okay, we're going to be going over two main categories when we come to this. It's going to be you as a person and what your personality is, and then the actual different techniques, which is about roughly 10 of them that I'll be going over in this video. So the very first thing is, like I mentioned at the beginning, is knowing who you are will help narrow the list of strategies to pick from. There's different personality profiles you can go online and take. There's Myers-Briggs, there's Strengths Finders, there's Colby Index, Culture Index. There's so many different ones out there. If you just do a search, you can find some and go ahead and take those because you'll get a better idea, you'll better articulate who you are and what kind of fits you, what kind of work environment you like, what kind of, how you respond when you're under pressure, so that you can maybe find a strategy that's going to fit well for your personality. So it's very tempting, I know, when you go to different conferences or talk to your buddies about something that really is lucrative and you think, oh, I'm going to go do that because you can make lots of money doing that. I'd say pause, consider it, but consider yourself first and what fits you so that you can fit something that will work. Because all of these strategies that I'm going to go over here in a second can make you more productive and hence make you more money in your practice. But if it's not a good fit for you, it's just not going to work. If you find the right one, you're going to actually enjoy what you do and have a more profitable and successful practice along the way. So like what I just said, don't focus on what you think is going to make you money. You can make money off of all of this. Go with a personal fit. Market demand and your willingness to pay the price are really going to determine which strategy you're ultimately going to decide on. And don't look for something easy. Instead, shoot for something that's satisfying yet still challenging. Too many times people are looking for the easy, quick fix thing, looking for the biggest ROI is what they try to dress it up to be. But basically, they're just trying to find an easy way to be productive in their practice. And I would say instead, find something that really energizes you or satisfies you. That's going to end up paying off in the long run. And then when you do finally settle on whatever strategy, you have to ask yourself, can you sell these strategies? Meaning persuade, convince, is it something that your patients and staff will go along with? I know as far as staff is concerned, you can always try to find staff that match up with your vision of where you want to go. But you have to just make sure that your patient base and your overall approach that this is going to actually match with your marketplace. All right, let's move on to the next thing. First questions you need to ask is, do you want to be a solo practitioner or do you want to be in a group practice? And then also need to ask, do you want to stay in your current space or do you want to move or perhaps maybe even expand your current space? You can think of this graphically like this. Think about where you want to be in 1 to 3 years. Put an X where you currently are, which would probably be in one of these two boxes. And then think, where do you want to be in 1 to 3 years? And then put a check mark in that other box. It could be in the same one. Maybe you just want to keep doing more of what you're currently doing, but you may want to be in one of these other boxes. This just kind of helps visibly show where you want to go, so it kind of makes sense to you and help clarify the direction that you're going in. And then I'm going to say follow or pick one of these following strategies, which I think there's about 10 of them, and see again which ones make sense to you. So I'll start with the first one. One way you can actually grow is just becoming more efficient. I have several videos here that you can see where we kind of include how to be more efficient with your actual dental work. Maybe you could do something as simple as working in same-day treatment can be added to your schedule. I know there's some dentists who just want to see one column, but if you could see two columns and stagger, like have a high productive column, a low productive column, that you can actually become more efficient and grow your practice. Again, all these ideas or these strategies are coming back to the idea of you actually growing your practice. Can you mix in small cases? Again, being able to work out of more than one column. Treatment times compressed. Can you look at every procedure that you do and find ways to kind of get rid of the things that are slowing it down? And I have, again, several videos that show that. Are you willing to invest in equipment and supplies in order to further compress that time, have multiples of whatever it is so that you can be ready to move like this today? And then, like I said already, just work out of more than one column. Maybe instead of efficiency or in addition to efficiency, you could work on your effectiveness. They have a thing called a high case average. Case average is when you're looking at your overall production and you compare it to overall new patients. If you take your production divided by your new patients, you get what's called a case average. It just kind of gives an idea over time, month after month after month, how well you're doing as the overall practice as far as the flow or the volume of patients that you're seeing. Do you have a correlating number of production numbers that seem to make sense? If you're having a lot of new patients but your production is low, then you're just spinning wheels. So you want to make sure that you have a good spread between your actual production and the number of patients that you're seeing. Also, a good retention rate. You want to have patients actually coming back, making a hygiene reappointment, same thing. Are they actually coming back to you, or are they having like a one and done and they're gone? If you're having that problem with people constantly leaving your practice, then that's a problem with your effectiveness. So if you could retain more patients, that makes more sense that you would then grow, because it's so much more expensive to go try to find somebody to replace a patient. You just rather keep the patients in your practice. Okay. High production per hour. Again, this is kind of your efficiency, but if you're effective at what you're doing, then you're going to increase, again, grow the practice. Low staff turnover is a good thing to have, because obviously if you have front desk, back office, hygienist assistants, if there's a big turnover, well, you can imagine how that's going to decrease the effectiveness of your office. So whatever it is that you need to do, pay more, better morale, whatever it might be, to kind of help get these staff members to really want to be part of your practice, will increase the effectiveness of it. High new patient count matched up with a good number of referrals. It's good to have a great, a new patient count up high, but you want to make sure there's a good number of referrals coming from. That means people are voting like, yes, we like you, and we want to take the social risk of sending both our family and friends, neighbors, coworkers to the office. And then upselling. Now, I know it sounds kind of weird, but can you actually talk to patients about things that are elective? Like, for example, there was someone in my office last week, a middle-aged lady, and she had across her canines these dark, kind of yellowish, caramel-colored bands going across her teeth. And I finally had a chance to visit with her. I hadn't seen her before, but she's also seen other dentists, years down from previously at other offices. And I said, those yellow marks on your teeth, I said, we could fix that. That's pretty simple. We could just do some bonding. It was like a little filling to kind of replace that yellowish enamel with something that's white to make it blend in. And she's like, oh my gosh. She goes, nobody has ever talked to me about that before. Yes, I really want to do that. So that's an example of being effective, or upselling, if you will. She came in for a cleaning, which she got, but when I did the exam, I mentioned something to her, something she did not mention first, but I brought it up, and she loved the idea. And so there's lots of patients that I talk to, and some of them are interested in what we have to say, or what I have to say, and others are not. But if you don't ask, it's not going to work. So that's a way of increasing through, we'll call it upselling, being more effective in your practice, in a way of growing it. All right, here's another strategy. You could expand your hygiene department. If you have lots of people coming in through hygiene, it just stands to reason that you would then have more mouths to look at, more teeth, and therefore you'd have a greater chance of actually seeing something that needs to be corrected. I'm talking to patients who have needs that want to be fixed. And so, are you willing to grow your hygiene department? Can you find hygienists? As I'm filming this is 2024, and hygienists still in America are difficult to come by. But if you can find them, then great. You could expand your hygiene department. Also, if you have a limited number of hygienists, what you can do is do an accelerated, or called team hygiene, where you give one hygienist 2 operatories with an assistant, and then hygienists can go back and forth and typically see a patient load 50% more than what they're currently seeing with just one column. So that's another way of expanding hygiene. Okay, incentivizing staff. This is where you're actually going to turn over some of the control to the staff. Let them make the decisions. Give them more of an empowering position. But now here's the kicker, is that you have to be willing to pay them for their current job that you're already paying them to do. I know some doctors, some owners will balk at this idea. They think, well, I'm already paying somebody to answer the phone, or to do checkouts, or to assist, or whatever it is, and then the idea of paying them more just to keep doing their job seems offensive to some owners. They think that that's not right. Well, you have to just realize that's human behavior. And if you're willing to pay your staff above and beyond through bonuses, then that will help grow the practice. And I guess this comes down again to understanding yourself. Is this something you're willing to do? Again, is this right, or if it's wrong? Well, that's up for you to decide. There's one of many different strategies that we're going over here. How about adding more procedures to your mix? Okay, you have to consider, of course, the cost of getting into these different procedures, placing implants, sedation, ortho, all the different things you could add to your current mix. And then maybe you want to test your patient demand. Are you currently referring these procedures out? Like, for example, endo. If you are referring out lots of endo, that means that you could learn how to do endo and do more of it in-house. But if you're not really referring stuff out, you're not seeing these problems come through your office, then maybe the market isn't there. Maybe it is. We can go over that on the next couple of slides coming up. Just as a side note, you can use sedation as an enhancer, meaning you're already doing some procedures, but some patients hold back on treatment because of the fear of going to the dentist. And if you could offer sedation, that may unlock the door for you to do more procedures in your office. You could also work on becoming the authority, meaning kind of a subspecialist, if you will, in your area. Not a true, board recognized specialty, but those areas where you like to focus on. Now, in order to do this, you have to capture a digital audience, because in order for people to think that you're the authority, or buy into the idea of all your education and what your real passion is for, you're going to have to get the word out there. Be willing to promote and advertise and actually put money behind it. You have to build your office messaging around that, and then you have to go all in on this certain niche or this boutique kind of practice that you want to run. Here's some examples of becoming the authority. Maybe it's in cosmetics or sleep medicine, airway development, holistic, high-tech dentistry, laser, TMD, sedation, implants. These are all different areas that you could become the authority in your area to draw patients specifically for those kinds of procedures to your office. All right, a couple more. You can increase fees. Now, this is always a favorite of dental consultants when they come in. They simply say, well, just raise your fees and you can make more per procedure. And that is mathematically true. But many offices I know that are taking PPOs, you have to be willing then to move away from some of the lower PPOs in those contracts in order to open up more spaces for the same procedures by better paying insurance plans or maybe even out-of-network plans. You have to also ask yourself, does your new patient growth support cutting these PPOs? And when I say the net patient growth, you don't just look at new patients, you look at your new patients plus your reactivated patients and subtract your deactivated patients. So the definition, like a reactivated patient would be somebody who hasn't been in your office for over 3 years and now they're coming back. That's a reactivation. A deactivation, typically by standard definition in our industry, is somebody who hasn't been into your office within the past 24 months. They may not, they're not like left the office, like never coming back. They just simply have not been back. You're going to have to come up with some definition. So we say 24 months, that would become a deactivated patient. And so when you look at those three numbers and you run the math on it, you'll be able to get a net patient growth to kind of see which way you're going. And if increasing fees by, again, cutting PPOs, can you fill in those holes by having other patients take those spots? Are you good at generating referrals? Because if you have good referrals, it means you're very popular, which means you now have the ability to maybe test a higher fee. And then when you want to raise fees or cut PPOs, you have to ask yourself, what is really driving this decision? Is it more logical or more emotional? I know there's many dentists who just get frustrated with the whole insurance thing and decide they're just going to cut the plans and just see what happens. Well, as you can imagine, that can be reckless if they don't have some of the underlying foundational things in place first. Then you have to know how much each PPO is represented by your patient population. You would then decide, are you going to cut the PPO plans that pay the lowest fees, or the ones that are the lowest percentage of your patient population, so you don't shock the amount of volume coming through your office? And then are you willing to spend thousands of dollars on marketing to replace patients if you decide to move away from some of these PPOs? Okay, you can also add a doctor and just be a duplicate doctor. That means you're currently so busy that you're turning away your current procedures just simply because you're out of space. I mean, you just don't have enough time for yourself to do it. And so this is usually a capacity issue. Now, if you do decide to expand, bring in another doctor to just kind of handle the overflow of work, you have to decide how are patients going to be divided up. And then are you really hoping that this replacement doctor may allow you more time off? It has to be just right, meaning you need to have a good, solid leadership team in place. Systems have got to be there, because in my experience, most doctors who try to take off time in hopes that another doctor is just going to be a direct replacement for themselves, it doesn't typically work out that way. Usually an incoming doctor, especially a non-owner doctor, simply doesn't put up the same kind of numbers, at least from a productivity standpoint, as the owner doctor does. Or you could add another doctor and diversify. So now what you're doing is taking some procedures, then you're dividing. Some go to one doctor and some go to the other. Let's take, for example, endo. Maybe one doctor does predominantly the endo in the office and another one does mostly the ortho in the office. And so you just kind of divide up things that way. You have to decide, how we're going to divide things up. And then if a certain doctor leaves later, how are you going to handle warranty issues? Again, not a reason to not do this. It's just something to think through and consider when you're moving forward with this. And then who's going to treat what? And then another way of doing it, just maybe bring in a specialist, somebody who just does maybe third molars or endo or ortho or perio or pedo. You can bring in a specialist to handle some things. You're diversifying, you're adding a doctor, thereby growing your practice by some sort of independent contractor. And then the last one is actually a new location. All the other strategies I just mentioned, I think those are all things you would try first in your current location before you would try moving to a new location. Because these days, moving to a new location is probably going to cost $1 million plus to get it just right. And so you have to assume that you're profitable in your current office. You would never want to take a dysfunctional office and expand it and magnify the problems in a bigger office where there's more on the line. You're going to assume you're already pretty efficient and effective with what you're doing, and that your current demand is more than your capacity can handle. And then if you're going to expand because you think you need to do this in order to create that authority image, your current location needs to confirm that you really are selling something, or at least promoting something that your market wants. So in summary, when I go through all of this, at the very beginning, we talked about find a good fit for you. I went over several different strategies here. Think about the one that kind of you gravitate towards, the thing that seems to fit your personality. Go towards that, okay? That's what you want to do, is find something that's good for yourself. And then all these strategies are going to fit basically in these three different kind of categories. You can get more patients by improving the quantity of patients that you're seeing, like more hygiene, becoming more efficient, running more than one column. You can increase the dollars per patient visit. You can do it by bundling, meaning you're adding in same-day treatment, or you're putting on more into that visit than what normally would have been there. Or you can do more dollars per service, and that's premium pricing. You'd be cutting insurance plans, replacing them with better PPOs, or maybe even getting out of network completely or partially in order to get more per procedure. So these are the main three levers to pull. Again, you got to pick the right ones for you, and there's several different ways that you can grow a practice with doing your dental art the way you want to do it. All right, take care. Thanks.